Okay, this is the April 7th, 2020 Porter County Board of Health meeting. Turning it over to President Moe.
Thank you, Kurt. We have reached the assigned meeting time, and I understand we have to do a voice roll call, calling each of the individuals. It looks like we do have a quorum based on the camera that I'm looking at. So we need to do, let's do our board members first. I am Martin Moeller. I will ask, I see Donna Warner. Donna, will you say that you're here?
Yes, I'm here.
Thank you, Donna. I've got Elizabeth Forbes.
Yes, I'm here.
Thank you, Elizabeth. Suzanne Phelps.
Yes, I'm here.
Okay, I see Suzanne's face. The sound connection was a bit sketchy there. There you go.
Yes, I'm here.
Tell us you're here one more time, Suzanne.
Yes, I'm here.
Thank
Suzanne Phelps,
you.
sorry.
Okay, Kathy Lemon.
Yes, I'm here.
Thank you, Kathy. I see Dr. Patrick Fleming.
Present.
There we go. That's great. Thank you, Dr. Fleming. And Dr. Gasper.
I'm here also.
Okay, that is all of our board members. We have our health officer, Dr. Maria Stamp.
Here, good evening.
I'm not seeing Maria right now. Oh, there we go. We got a little bit of a delay on things, but yes, Dr. Stamp is here. Our attorney, Dave Hollenbeck, is here.
I am here.
Okay, and I saw Letty is on here.
I am.
Okay, so we've got Letty, and I don't know, we've got, well, Connie's picture's coming up.
I'm here, yes.
Okay, so we've got Connie on with us. And did I see Sheila also?
Well, it's not Sheila, it's actually Jess Mahler. I'm the epidemiological nurse. But I'm using Sheila.
Okay, so you're our epidemiologist.
Yes.
We'll be coming back to you at the appropriate time. And who am I missing on here that I am not flipping over to?
Chris.
Oh, well, Chris Contrino. Yes. Okay. Have we listed everybody that is in attendance on our meeting?
Yes.
This will be for Chris's sake. So since we do have a quorum, we have everybody recorded that is with us. We will open our meeting with the traditional Pledge of Allegiance. I think Kurt's going to put a flag up. I brought one of my own here. So, well, you get special dispensation. You don't need to rise, and we will begin the pledge. I pledge allegiance to the flag
of the United States of America, and to the republic
which
which stands
And
one nation
under God,
indivisible,
visible.
with liberty and justice for all.
Okay, that's tricky when we all talk at one time there. We do have the minutes from our meeting in March. There was one thing, Chris, that I noticed that we might need to amend. It says a motion to approve the January 2020 claims was made, and I think we approved the January and February claims. We might need to include February on there. Otherwise, I would move for a motion to accept the March minutes as they're presented with that one amendment.
I move that we accept the minutes. This is Kathy.
Thank you,
I second.
Kathy. We have a motion by Kathy and a second by one of our other board members. And I-
Donna Warner, second.
Okay, we got a motion and a second. All in favor designate by saying aye. Aye.
Aye.
All opposed? Any opposition? Seeing none, motion carries. We have approved the minutes. The only announcement on our agenda, actually, I believe shows up under the new business, would it probably be our May 5th board meeting, which we will keep on the agenda there unless Letty has a different announcement that she needs to make at this time.
I do not.
Okay, so we will plan our normal May 5th meeting, and then we will move into the heart of our business this evening, which is the COVID-19 update. And I will ask either Dr. Stamp or Letty, who would like to begin and who would we like to bring in first to tell us what has been done over these last 4.5 weeks.
Martin, I'm happy to do that. So our last Board of Health meeting was March 3rd, if I remember correctly, and it's kind of crazy to think what a difference a month makes. So please let me know if you can't, if video's not keeping up with my voice, if you can't hear me, those kind of things. I have about 4 pages of notes to go over with you quickly. I tried to keep it to things that were of significance that the board would want to know about. So I'll go ahead and get started. So the first positive case that we had taken care of in Porter County of COVID-19 was admitted to Porter Regional Hospital on the 14th of March. That patient was actually not a Porter County resident, but a LaPorte County resident. And Porter County did not actually have its first case of a resident of Porter County until about the 23rd of March. Since that time, we have had anywhere between 1 and 10 new cases daily. For instance, about a week later, on the 27th of March, we had 9 cases total in our county. As of this morning, we had 78 cases in our county. We've had no deaths in Porter County. And I can break down a little bit of the demographics of the cases that we've had a little later. But that gives you some perspective as to where we are on our curve. We talk about flattening the curve. Well, the curve is rising right now. And that's expected. It is everywhere in Indiana. And in my assessment, I think we're doing pretty well given the state of the United States and the state of Indiana. Before the governor's stay-at-home directive, which was I don't have the date on that when that was initially put into place, somewhere in the past 2 weeks. Before that, we participated in a regional preparedness meeting. This was the beginning of March. Ironically, this regional meeting had hundreds of participants. And looking back on it, I think that probably wasn't the wisest thing to do. These were participants from all over northern Indiana. All of the important people for first responders and hospitals and elected officials, also and health departments. So it was a fairly high risk group of people. As far as I know, we are all okay, thank goodness. But it was a helpful meeting, but it probably was not in the best interest of social distancing. We also spent some time coordinating with the schools, with the hospital here, Porter Regional, and especially too with the county, because there were some large events that were coming up. We arranged for kind of how social distancing within the county offices would work, and whether and some events were canceled. So events at the what's it called, the conference center or the fairgrounds. Shipshewana was on the road, was there, and there was another fairly large event that was canceled too. And these were all done before our first positive case in Porter County. On March 12th, I and Letty and I believe Connie was, I can't remember. I think Connie was there too. We met with all the school superintendents within Porter County and kind of discussed risks and benefits of closing schools and how that would work. And the decision was made to close schools across the county that week before spring break. So starting the 13th of March, schools have been closed and switched over to e-learning. Then another significant thing that we've been working on is testing coordination. Testing in Porter County has been limited really to a few sites, Porter Regional and Couts Family Clinic. And then I believe there's been some small amount of testing done at North Shore. But outside of the county, they added Franciscan and Michigan City, and there's been some Lake County testing also. Porter Regional has really very strictly followed Indiana State Department of Health's guidelines for testing, which are quite narrow. So it is been difficult to get testing done there unless you follow very specific guidelines and have a testing reference number. However, when testing is done at Porter Regional, it's the turnaround time is pretty quick. It gets down to Indianapolis, gets tested, and generally gets resulted in 48 to 72 hours. Kathy Lynch has helped us out quite a bit in Couts. She had availability for testing really quite early on, which was nice. And she was the provider, ordering the test. So, so she was doing, she's done, I think, almost a couple hundred tests over the past 3 weeks. The drawback of her situation was that it was really taking a week to 9 days to get results back, which in some situations just isn't as helpful as we would like it. I think, as I understand it, her testing ability has kind of dried up a little bit in terms of her supplies, swabs, and viral transport media. Testing has been kind of an issue. We at the health department looked into testing at a number of through a number of different labs. Their turnaround time was a problem. It was a problem actually finding labs that would work with us and give us supplies. We finally arranged for being able to get some test swabs that we can send to Alverno. And they have a pretty nice turnaround time of 2 to 3 days. The testing that the health department, where we see our role is where we feel that there's a significant public health need for testing for specific individuals, small numbers, and they can't get testing done elsewhere. For instance, we were able to test a community member who had a fever, and some police officers had been exposed to this community member. So in the interest of figuring out the risk of our first responders, we were able to get this person tested. And so that was helpful to get our police officers back in commission in short order. So those are the kind of things that we see our role in testing right now. Moving on, we did some messaging along those lines for testing for Porter Regional. Porter Regional has had their hands kind of tied by their corporate organization as far as public messaging goes. So they actually reached out to us saying, please, can you help us get some information out to the public about testing availability and lack thereof, and what the guidelines were for testing. On the 17th of March, John Peisowitz and I, he mainly did most of the speaking. spoke with to the commissioners in an empty commissioners hall, which was interesting too. But he gave a very good talk about where we stood in terms of preparedness for COVID-19. And that was the 17th of March. On the 19th of March, it was announced and kind of arranged for the District 1 Emergency Operations Center to set up in Gary at the airport. They are, so just as a reminder, District 1 is Lake County, Porter County, LaPorte County, Newton County, and Jasper County. And we felt it was important to support them as we as a region have more say within the state than we do as an individual county in terms of asking for supplies and help and resources. So that has been taking the past couple of weeks to really kind of gin up and get going. We've been working on PPE or personal protective equipment and the situation there. We've been working closely with EMA and Lance Bella, who's the director of EMA, on that. And John has been working very hard on this, getting needs to the state and getting supplies when we can get them. We have had one shipment from the SNS, or the Strategic National Stockpile. When we received that, it was actually a fairly small shipment. It was stored at the EMA with Lance Bella, and it was distributed to the following groups who had requested it. It was distributed to first responders, to long-term care providers, some independent doctors' offices, to hospice, to Porter Stark, and to HealthLink. Hopefully I'm not missing anybody there. We have also had some donations of personal protective equipment and things like sanitizer from the schools that have, are not in session now and have had extra. So that's been really nice to have their donations. The local distilleries have been making sanitizer. And that has been, as I understand it, available at least for EMA for first responders. We might get another distribution or disbursement from the Strategic National Stockpile. Initially, they said they would. This is from the state because it goes to the state first and then to us. Initially, the state said, this was on March 24th, said that we would be able to get another disbursement. But then they said, no, it's probably not available to us. And now they're saying we might get it. So we don't hold our breath, but we're thankful when and if it shows up, and we keep asking for it. There's been some other things that we've done. The hospital, along with EMA, they've evaluated and arranged for an alternate care site in Valparaiso, where the hospital could use if they needed overflow and were filled to capacity. John and I looked at the old ventilator unit at Whispering Pines on Calumet Avenue as a possible, small scale alternative site. And we gave that information to the hospital as they would be the ones that would be really, using it and helping to set it up if they feel that's important. We've also had calls from a representative of the emissions test sites in Porter County. I believe there are 2 of them. Those could be, if in the future mass testing is available, those could be sites where we could do drive-up mass testing. They're kind of set up beautifully for that. And we'll continue to kind of talk to them and, heaven forbid we need it, but if we need it, I want it to be available and not take too long to set up. So we're looking into that also. As far as communications go, we've been having twice weekly teleconferences with all the county department heads. And then the Indiana State Department of Health has a webcast that we've been tuning into twice a week, I believe. And then for providers, the State Department of Health has a webcast weekly. Commissioner Blaney and Kurt Ellis have been instrumental in arranging a daily updated dashboard on on the county website. I don't know if any of you have seen it yet, but it was up and running starting today. It looks very nice. And that will be updated daily. It looks very similar to the one that the state has, and gives a breakdown of positive cases in Porter County, their gender, their age distribution, if they're hospitalized, and what township they are, what they reside in. The first responders were very interested in having the 911 dispatchers or having some access to where positive cases are within Porter County so that they can take extra precautions if they are called to a home where there's been a positive COVID-19 case. We were able to arrange for the dispatchers to receive the addresses where those cases reside, and they can enter those in the database. And then if a first responder gets called to that location, they have a special code that tells them that there might be someone there who has COVID-19 and they should take extra precaution. We do encourage our, that said, we do encourage our first responders really to avoid close contact when possible, use appropriate protective, personal protective equipment when available, and kind of expect that anybody could be infected. Working with law enforcement also, in terms of, since the governor has had this directive about essential businesses only being open, we've had to work with law enforcement as they need guidance on what really is an essential business. And that has kind of worked well, those discussions. Sheriff Reynolds is this week going to send his analyst, so one of his intelligence investigators, over to the health department to see if she can work with our data to see if they can point to any additional, infection sources or something that we're not seeing. And we're interested to see kind of really if there's anything extra that we might be able to use to minimize the spread of the virus through her resources. So with all of that, I have to say that, normal health department work is still happening. For instance, we have a new TB case, active TB case that had to be worked up in the month of March. We continue to treat STDs. When they come to our office for treatment, the treatment nurse meets them at the door. They do everything by phone until they get to the door to take their medicine. We have stopped immunizations for now, but are looking to, when we're able to open back up again, looking to figure out how we can triage those patients to make sure, for instance, the infants who have not been able to get their vaccines at all, how they can get them right away, and kind of triage those immunization needs, vaccine needs for when we are back up and running from that aspect again. Food and environmental keeps working, although at a little bit more limited pace, or a slower pace. And then anabuse continues also. So we've, Connie has been really good to kind of adjust the kind of protocol she uses, not protocol for who gets anabuse, but how anabuse is dispensed, and how many people are in our waiting room and that kind of thing, how people are spaced out. And really trying to make sure people stay safe and still can receive their anti-abuse doses. One of our anti-abuse nurses, Dwayne, chose to retire, which was a very reasonable thing. He's in one of those higher risk categories. So Connie's picked up a little bit extra work there with the anabuse work. But everybody in our department has been great to kind of pick up the slack and volunteer to help wherever they can. All our nurses, initially we were working with a skeleton crew of, pretty much half the office would come in on any given day, sometimes less depending on which department they were in. But really since the weekend, and our numbers are climbing of positive COVID cases, all our nurses have been in, and we've recruited our part-time nurses who usually just do immunizations to come in also and help us with case investigations too. So of the 78 cases that we have had to date in Porter County, 23 have recovered, so we're no longer needing to keep track of them. They are all better and released to the regular stay-at-home order. Another interesting thing about our cases in Porter County, 23 of those cases can be found within 10 families. So it's been very frequent that we see a husband and wife get sick, a husband and wife and a child, and a kind of an adult child, those kind of things. We're seeing that quite a bit. I mean, it really is a disease that is caused by close contact. And then we have, for instance, now we have 12 patients that are in the hospital. So yeah, that is what I have to say about what we've been doing the past month. It's been a lot. I'm sorry, it's kind of a long report, but I wanted you to kind of see we're working from a lot of different angles with this. So that was kind of important. Oh, one more thing, along with the health department issues happen, we have our emergency preparedness deliverables are still out there. We need to do them. And one of those things happens to be a pod exercise. Now, of course, we can't give vaccine for this, and we can't give medicines for this, but John and I and Letty felt it was important to actually, if we can get it done, do the pod exercise. If a vaccine becomes available, we will need to mass mobilize along those lines. So Connie was involved in the planning of this too. It just is important for us all to be kind of have that dusted off a little bit so that we know what the plan would be when we need a point of dispensing situation to happen. So thanks for your time.
Okay, thank you, Dr. Stamp. This is Martin Moeller here. What I'd like to do is keep you there. I'm going to like to let our board members ask you questions that they might have. I'll start off with, you answered my one question. Of the 23 that have recovered from the virus, they get subtracted then from the 78, meaning we'd have 55 active cases that we're aware of right now in the county.
That's correct.
But my question, the 12 in the hospital, would it be a violation of HIPAA for you to tell me how many of those 12 are on respirators?
I might need to let Jessica answer that one. I think we're at like 3 or 4 that have been on respirators. Some of them have been weaned off the ventilator, but Jessica might have better numbers on that.
There is currently 6 on respirators and 4 have been weaned off.
Okay, that's very good to hear. That's the only question that I have right now. I'd like to let the other board members take a chance at questions. And then before we leave Dr. Stamp, I want to come to Dr. Gasper and Dr. Fleming for their experiences, but I want to allow questions to Dr. Stamp first, specifically about the virus and care.
You guys are great. We know it all.
Okay, well,
No,
well,
this is Kathy. I just have a question. How do you go about getting the testing kits? Do you have to request those? Is there a certain number that you get, or are we limited?
Right, so it depends. Hang on, I'm gonna unmute this different. Okay, so the testing supplies, which include a swab, a nasal swab, and then a test tube like thing that is what we call the viral transport medium. So those two items, and then a special purple bag or something we put them in to like alert the lab that that's what it is. So those are the testing supplies. And they actually are kind of hard to come by. Normally what happens is that you have a relationship with a lab, say LabCorp, Quest, Alverno, whatever. And based on the type of testing that you do in your clinic or facility, you receive free of charge. I mean, really, it's all bundled into the cost of the test, the testing supplies. Now, the state was supplying testing supplies to an extent for the hospital. Well, actually, they were for the hospital because they were doing almost all their testing through the State Department of Health. For us, we looked at a number of different labs. And the lab that we already had, well, I shouldn't say that. We ended up with a lab that we already have a relationship with. So we already have an account set up with Alverno. We've been sending our blood work to them, those kind of things already. And they were ultimately, when they were a little bit slower to get set up with COVID-19 testing. But once they were ready to work with us pretty much right away. The other labs that we had looked at either were expensive, or one we said, well, this one will work fine for us. And we set up an account with them. But then, a week later, we were still unable to get a hold of them to get us any testing supplies. So it really was kind of hit or miss in terms of the lab we were working with. And ultimately it came down to, when you look at the Couts Clinic, it came down to they already had those type of testing supplies in their supply cabinet, and they already had a relationship with Quest or whoever. I think it was Quest they went through initially. So it was kind of about who you knew and who you could get set up with. So that's how testing supplies worked in Porter County.
Thank you.
Hi, Dr. Stamp. This is Suzanne. I had a question just about PPE in general. Like, are you finding in Porter County the status of our PPE is good? Do we have enough? Does the hospital have enough? Do you guys have enough? Like, what is the general overview of that?
Right. So there is I guess it's a database where the hospitals and the health departments enter the amount of PPE they have, and they enter, for instance, the hospital will enter the number of ventilators they have available and that kind of thing, kind of on a daily basis that goes to the state so they can keep a kind of running tally. The state has been sending shipments of PPE directly to the hospitals. So, and as I understand it, they are they're in a reasonable place right now. They have, the hospital has been really working to preserve their PPE supply. I certainly wouldn't say that they are keeping their employees or whatever, their associates from using PPE. That's not the case at all, but they have been really doing conservation strategies to be able to maintain their PPE supply. Some of our other partners, nursing homes, had been struggling quite a bit. So our nurses and Jessica, when they call, have been giving them information from the CDC, the guidance on how to preserve the PPE, and then we're trying to get them what they need. They have been pretty resourceful. They were the first ones to kind of jump on using and making homemade masks and those kind of things. And I think those are, to some degree at least, can be helpful. So that's where we kind of stand. We have some supplies available for people who are, for entities who are kind of in dire need, but not very much. We're not reserving very much for ourselves at this point.
Dr. Stamp, it's Dr. Gasper. Quick question for you. What would happen if we did have an outbreak in a nursing home? Is there kind of a response team that takes over? How does that work?
Yes, in fact, so I was going to mention that to you because that was one of the interesting things that kind of happened in the past couple of weeks, is that we did have a positive case of an employee in one of the long-term care facilities in Porter County. And then actually there were a couple employees that were positive. And the state Department of Health does have what they call a strike team specifically for long-term care facilities. And Jess called them right away and let them know about the situation, and also told the director of nursing at this long-term care facility that this strike team was available to them. I understand they had been kind of talking back and forth and keeping up with the director of nursing there, and or the director there, I'm not sure which. And I understand that they actually came up, the strike team actually came up to this facility just in the past day or two, and has been working with them on site. So that is something that is absolutely available to nursing homes and other long-term care facilities, this strike team, to help with kind of wide-scale testing within the nursing home and make sure that they're doing the best infection control procedures that they can do.
Martin Moeller back here. Do we have any other of our board members that have immediate questions of Dr. Stamp, or are we ready to let Dr. Fleming tell us? So Dr. Fleming, I'd like you to just give us your experience over the last 4 weeks and any opinions that you have and any recommendations. So kind of carte blanche here for you.
Well, I think we've had about now where the staff and everybody else in our office and the families affiliated with them are finally more secure and relaxed. But otherwise, just like this whole thing, it was a fluid moving process. And for the last 3 to 4 weeks, it was very stressful. Every day was different. And at first, there were just too many mixed signals, and it was frustrating in terms of having family and colleagues in Asia kind of trying to give us their 2 cents, and then not being able to do the testing 3 weeks ago, but it was nobody's direct fault. It was just that I was ready to start doing some testing, and then the rules would somewhat change from the State Department. And it was daunting for the first time in 20 years, a day, having to stop and think different algorithm of how to manage either a sick patient or the contact of a sick patient. And just due to the way this thing changed, was seeing sick patients, then it was seeing sick patients in 2 designated PPE rooms, then it was maybe just trying to get a rapid strep and or a chest x-ray for specific sick patients. And then it became, we as an office, more patients and less specific issue like a mass of urgency or a suture removal or something. And even that was done in specific assigned rooms with PPE at all times, to now where we're almost 100% of tele visits. And it's become very evolution. I think it was the frustration of not being able to test, and patients getting frustrated and staff getting worried, and those things have just evolved. And looking back, stood just as now we're back to masks, things of that nature. I feel as though my wife and I feel as though we have some control over this, and it wasn't. For example, I saw an ill patient that I wanted to test for COVID, but that day they changed that was on the 12th. They changed where the state said, I'm sorry. Now, even though they've had recent travel exposure, shortness of breath, a fever, and a cough, they're not critically ill, so we can't test them. And so that's how it all started. And on a personal note, unbeknownst to me, I wondered me down that night, making sure we'd gotten home, showered, changed before we touched the kids. And she had to apologize because the following day she was inviting 50 people over, 12 of my family members throughout the country, to surprise me for a birthday party that she then had to cancel within 24 hours notice. And it just changed everything and every way we do things. But I do feel now, as Maria was saying, things are fluid, they keep changing, but every day we sort of get a new foothold. And I think we've had for 5 days now a solid foothold on test, manage how we're going to evaluate, how we're going to triage, and just a huge support, I think, from the community and a majority of the public that fell in line with social distancing, reaching out, neighbors, saying thank you, getting letters from family, friends. So niece in New York were probably the first COVID immune family in New York. That was what they were going through at the very same time. So I was glad we didn't have the party. But that's a little bit my perspective, and can say now, I feel fortunate to have a wife that has an amazing knack and perspective on how to keep Dr. Fleming's cowboy cavalier, nothing's going to hurt me attitude to really getting things done in a formidable, organized way. And that's one of my benefits from having that. But I don't know if Derek and Maria have felt that that's not a bad nutshell of how we've spent the last month. I think we've slept well the last 3 nights.
Boy. Okay, thank you, Dr. Fleming. We might come back to you, but I'd like to let Dr. Gasper get the same opportunity that you just have, and then we'll let board members ask the 2 of you or Dr. Stamp more questions.
First of all, happy birthday, Patrick. What was your 30th?
39.
39th, good. And thank you to all the staff at the Porter Health Department. You guys have been doing a great job. They came out and helped me with one of my patients at a nursing home. We were kind of in dire straits with what to do, and it was pretty seamless. So thanks, everybody. Appreciate the help. I would echo a lot of what you said, Patrick. At first, it was very quite scary. I had no idea where this was going to go. It rapidly developed. I mean, once we started saw the data from Italy and Spain, my heart kind of sank a little bit. We immediately started to do a lot of telehealth. So even all my nursing homes now are all done via computer system. I have the nurse carry me around on a computer, talk to residents. Some of the nurses are great at doing exams for me. It's been very beneficial to keep down my exposure and also their exposures. My biggest fear is if it gets in one of my nursing homes, because they just don't have the people or a lot of the PPE. So I'm glad to hear that there's a strike team to help, because that was a fear of mine. I had no idea what I was going to do. This is all new. And as far as testing, It has been frustrating for the population. One thing that I remind people is it's not going to change what we do. Assume you have it unless we can figure out a way, another diagnosis for what you have, and just stay home until you're better. Good rule of thumb is what the CDC says: stay home for 72 hours until you're fever free, or you've been at least a week since your symptoms started and you're better. That's kind of the guidance I've been giving people. And there's a lot more hope now. I think that things seem less catastrophic as they did about a week ago. That's all I got.
Thank you, Dr. Gasper. I do want to touch, as I'm looking at things, I'd like to ask Elizabeth. I think she's still in active practice, and ask Elizabeth what her experience have been these past couple of weeks.
Yes, thank you. And thank you for all that you're doing and the updates. I really appreciate it. The daily updates are wonderful. I look for that, look forward to that every day. So I work in 2 different settings. I work in a Porter Regional Hospital, but the Portage campus, and I work on an inpatient rehab unit. We have 14 beds. Our average census is about 11. So the one thing that I noticed the second company that I work for, let me backtrack a little bit, is Regency Hospital, and they're a long-term care facility. They're known as Select now, and they have approximately 22 beds. They specialize in vent weaning and long-term antibiotics and people of chronic illness. Just based on the difference in the 2 companies, and there have been some differences on planning and preparedness and communication. That's interesting to see. I think that what both hospitals are doing now as far as PPE preservation is they're having the nursing staff all wear a mask at all times, but to wear that same mask, and it is a just your standard yellow mask. Now, if you're going to be caring for someone on with a aerosol trach collar that's got a nebulizer treatment, that has more of a tendency to aerosol that COVID into the air and could cause it to be more suspended. So they then are recommending a full isolation gear, which is head, face shield, everything. Like, they actually got all that equipment in at Select Hospital the other day, and my boss dressed up in it and walked down the hallway to show everybody what that looked like. So the problem I see actually with the masks being used for a long time is they get moist, and then people start to touch them. They're very uncomfortable on the ears, and so touching them is a problem, because now you're telling people don't touch your face, and every one of my coworkers is adjusting this mask all day. And so that's a problem. And so I've noticed that when you get those homemade masks in, which we've got a lot of those in, and they're nicely made, they can be way more comfortably worn, and you're not touching your face with them. So it's kind of give and take with the personal protective equipment. There's some benefits to some and others. So it's heavy there. Patients are wanting to be with their family members when they're sick. And that's a sad thing that we have a no visitor policy now. Staff are scared, so that's a heavy feeling. But at the same time, I'm incredibly in awe at how people have come together and donated and have just lifted first responders, nurses, EMS, doctors, physicians, respiratory therapists, physical therapists, just lifted us up, come behind us and said, here, we appreciate this. So that's nice to see that the community's coming together that way. So that's my experiences. I haven't personally taken care of any COVID-19 patients yet. I anticipate that I will, or that I know of. So, but so far we're doing really well. Thank you.
Okay, thank you, Elizabeth. I did talk with Dave earlier, and because he has physicians in his family. I don't know, Dave, would you be willing to tell a little bit about your virus experience, or are you not prepared to do that in this forum?
No, I can share the experience in hopes that it would be of value. As some of you know, my daughter and her husband are both physicians in Indianapolis and were exposed to the virus. And to make a long story short, they are both positive. Unfortunately, their 3 children are as well. So we in the Hollenbeck family have had a very real experience with the virus and how it impacts on the physicians who are trying to deal with it. And when they go down, it creates shortages then for other peak doctors who, incredible medical professionals, in this case in Indianapolis, who go into these environments knowing full well the exposure and the risk that they could experience. Our experience in the Hollenbeck household has been pretty consistent with what I'm told is occurring, and that's that 3 children who were involved did have fevers, but the fevers broke in a couple of days and have had, at this point anyway, no real other consequences, as best we can tell, other than the emotional consequences of being literally locked in a house with parents that are sick. My daughter, we discovered, probably wasn't telling her parents how sick she was. Our son-in-law was very sick and spent a number of days close to going to the hospital, back to the hospital, but did here in the last couple of days tell us that a major corner had been turned because he felt better today than he did yesterday. But he's described the same symptoms. I don't know if any of you watch Chris Como on CNN, who has got it and is broadcasting every night, telling people what kind of a day he's had, and very consistent with what Keith told us in terms of the chills and the fever and the difficulty in breathing and the lungs filling up. So it's nothing to laugh at. I've had some people tell me, well, shouldn't we just go out there and quarantine all the old people and the people who have overriding medical problems and let the rest of us go around and get it and then become immune? I've seen and heard from my family, this is nothing you want to get on purpose. You are very sick. And it looks now like we've turned the corner and that the Hollenbecks in Indianapolis are on the way to recovery. In the true spirit of the medical profession, my doctor or my daughter is trying to get cleared so she can go back.
Oh.
That's fantastic to hear that much, Dave, and I hope that they remain on that same trajectory in the days ahead here, and that they can get back to work, and maybe that their antigens can be utilized if we figure out the best way to do that. I should ask Susie. Susie, I don't know that you're in other than the classroom. Are you in an active nursing setting other than the classroom that you would want to share?
Well, I was doing some part-time work at a nursing home in Valpo, but I've been down to my parents in Florida for 3 weeks, so I'm quarantining down here. So I am remote teaching as best as you can and using technology like Zoom to try to, still connect with my students. But, I'm not currently doing any other active nursing at this point. So.
Okay. Well, thank you. And I'll ask now our board members, having heard from those various parties, particularly our physicians, if you have developed any other questions that you would like to ask them while we are on the COVID subject.
No, they answered all mine.
Okay, thank you, Donna. We've already spent almost an hour with a little bit of a late start. We didn't want to take a lot of time on Zoom here. So I will move on to our next new business item. I don't know if Dave wants to address the water testing at the 49er landfill, or if Letty might want to do that.
Let's let Letty pick up on that. That's the 49er landfill, for those of you who have been around as long as I have, has been closed for many, many, many years. In fact, it predated the Indiana Department of Environmental Management, which now regulates landfills. In those olden days, we at the health department regulated landfills. And I remember the calls that Keith Letta would get, and we both decided there was absolutely nothing of value that could go on in a landfill at 3 o'clock in the morning. And that's the kind of problems we were dealing with. There's been, through the years, obviously, concerns by adjoining landowners about how that may have been capped or not capped or closed, because it was done with very little oversight from the state or us in terms of process, because there were no procedures. And this recent effort that Letty is involved in is another effort. And I believe the state is doing some funding of some water testing of people that are concerned. And I'll let Letty bring you up to speed on that.
So on March 23rd, Dan, Mary, and the State Department inspector, they actually went to the landfill, and they had received out of 45, I believe 45 letters they sent out to the residents in that area. They received about 23 response of people that wanted their wells tested. So out of the 22 rather, 20 were actually tested, and that's only because one of the individuals forgot to leave the spigot outside, because the samples were collected from outside. And so everybody was asked to leave the spigot open, and one forgot to leave the spigot open, and then the other one was sick. And so they would have to go inside to get the sample, and the staff was concerned about going inside into someone's home that was already sick. So that sample wasn't collected. But what they did was, because they collected enough samples from all the areas around from those homes, they can still get a good picture of what's going on with the well water. So the samples were collected, and it's been about 2 weeks now that it was collected, and it's going to take about 6 weeks to get the results back, based on the fact that the labs are running behind. So we're waiting on that, and for the most part, that's pretty much it. What's going on with that?
I would add on
Okay,
that
thank
subject.
you, Letty.
Martin, I would add on that subject that this is such a matter of ancient history. This goes back before all of the laws that Congress passed about landfill closing and responsibility. And if in fact we find a problem, that then will precipitate the issue of what do we do about it. And it will be difficult, if not impossible, under present law to go back and try to have any liability attached to the, in fact, for lack of better nomenclature, the owner of the landfill as a corporation is long since defunct and been dissolved by the Secretary of State. So it'll be interesting to see how it comes back. It wouldn't surprise me if there's been some leachate problems, because it probably wasn't closed the way modern landfills are closed. Plus, there was virtually no records kept as to what went in. There certainly could have been some hazardous materials that went in before it was capped. So it could conceivably have some issues. My concern is, what are the remedies that will attach to that?
Well, we will wait and see, and we won't be able to deal with that this evening, but we'll take that as an update on what's been happening with the testing and wait for those results. I don't believe that we have any old business that needs attention at this time, unless Dave wants to address any old items as part of his report this evening.
I would, in the name of brevity, I would resist that, and let's move on in the agenda.
Okay, thank you very much, Dave. You did receive, Chris sent out to you the claims and receipts of the previous month. We will entertain a motion to accept the claims from, well, I guess that actually does say February that we got on there. My apologies for that. But we will entertain a motion to accept those claims by one of our board members.
This is Suzanne. I'll make a motion that we accept the claims and receipts.
Thank you, Suzanne. And a second?
This is Kathy, and I second it.
Thank you, Kathy. All in favor of approving those claims as presented, designate by saying aye. Aye. All opposed? Motion carries. Thank you very much. We will now, I don't know that we're going to do any committee reports this evening, but would like to go to Letty in particular and see what she might like to offer us.
I really don't have anything to report on right now. The only thing I want to say is that the staff here at the health department has been doing a fantastic job. I'm sure you know that already. I don't think I have to say this to you, but I really want to take this opportunity to thank everybody. The nurses are doing a fantastic job. I've never seen, this is my first time being involved in this type of situation and seeing how calm and collected and how well they are at talking to the patients. It's amazing. So I'm totally impressed with them. And we have been working on a skeleton crew. So we're trying to make sure that we don't ourselves get sick, because if we have to, in a sense, activate, we want to be ready. But everybody's been doing a great job. I want to say thank you to all of them.
Thank you very much, Letty. I'm glad that you were able to give a nice positive report on our staff. And I will add that I was a little surprised. I got to talk to Dan Boyd, and I have an appointment with him, one of our sanitarians, on Thursday for myself. So I was surprised that he was even in the office and available.
Yes, as a matter of fact, environmental has been working every day. We have a new person in environmental, so he's training. He's doing a fantastic job. He used to be in foods and he's transferred over. Tony used to be the head of the environmental division, and he chose to transfer over to foods. And we had Jacoby, who was in foods, and he moved over to environmental. So everybody's working out very well, and seems like everybody's happy.
Wow, I didn't know that, so I'm glad that I found out about that this evening. I would have called and asked for Tony probably. So then I will, if Letty, if you would concur that we don't need to do anything from our other committees, I will move to Dr. Stamp for some final words from her.
I would just like to echo what Letty said. We've been really, we've got a great staff. They're working so hard. And I'm hoping that we don't wear them out too much. Trying not to take advantage of them, and hopefully, and we're trying to get them to go home and get some rest when they can. That includes Letty too. She's been spending an awful lot of time at the office, and Connie and Jess, they've been really great. And all the nurses have been stepping up wonderfully, and Foods even has offered to help with investigations. And so really everybody's, stepping up to do what they can do. And we're doing our best to play nice with everybody else. And it's working okay. We're making our way. Thank you.
Thank you, Dr. Stamp, for all the time that you're being forced to spend more than is typically allowed for.
Yeah.
Martin, could I add two quick things?
Yes, please.
I've been doing this for 46 years, and I can't say that I've seen a pandemic, but I've seen the health department take on real challenges very well. And nothing compares to what our staff has done in the last 5 or 6 weeks. And don't think for a second that is lost on other people in that building. I think the commissioners, all three of them, have made a point of telling me how appreciative they are of and the word that's often used is professionalism that our nurses and our staff has shown in dealing with this. You always try to avoid creating the wheel. Well, we're doing a lot of creating of the wheel because this is so unknown and so new to everybody. So I really need to add my voice. And of course, when I say I've been here for 46 years, I started when I was 12 years old. But as the guy with the gray hair, I'm damn proud of what these people are doing. And I really, really appreciate it, not only as their lawyer, but as a citizen of Porter County. Secondly, if anyone reads the online version of the Times, you're already aware of this, but we've actually had our first arrest in Porter County for violation of the governor's executive order. And you can read the story in the morning in the paper. I'll just tease you and say that the arrest did involve alcohol.
Oh, okay. Thanks to our legal prodigy there, Dave. I will come back to our board members as we try to finish each of our meetings. If any of our board members have any comments or concerns for the good of the cause before we would adjourn.
Martin, this is Donna Warner, and I would like to commend our health department and thank them so very much for all the work they've done and the reports they've given us. And as you say, it hasn't gone unnoticed. So once again, thank you so much. This is new to all of us. So be safe and thank you for all that you're doing.
Thank you.
This is Dr. Fleming. I'd actually like to add to my comments earlier. They probably were less of appreciation, but 10 days ago when we got a weekend update on a patient of ours that was positive for COVID and how to manage, Jess over the weekend just did an excellent job helping me help my partners figure out how to manage, how to communicate, as well as those wonderful morning updates, weekend rain or shine from Letty, helping when patients ask me, when my staff is worried. We do sort of a little bit of a morning blessing now to get everyone on their feet, and I can give them updates because the Porter County Health Department has got its stuff together, and I'm proud when I'm on the board there. So thank you to everyone there.
Thank you.
Thank you, Dr. Fleming. This is Martin again. My staff also asks me what the update is for the day. They want to know, has the report come through from Letty yet with what the numbers are? So they all are watching for this. And so I forwarded them the county dashboard now so they can go directly to the county dashboard. And I do love, I'm a map person. I love the township map that's been posted. So I think Kurt is still listening to us also. So thank you, Kurt. Any other board members want to share something before we would entertain a motion to adjourn? If not, we will ask for a motion to adjourn and a second.
Dr. Fleming, I motion to adjourn.
We have a motion and I would like to get a second.
Beth Forbes, I second that.
We have a second from Elizabeth. Thank you so much. All in favor of adjournment, designate by saying aye. Aye.
Aye.
All opposed, motion carries. Our meeting is adjourned and we will turn the site over to Kurt to shut down or whatever the terminology is.
Stay well.